Hi, and welcome to Health Matter on Charity's Vitality vlog, the only channel that seeks to give you the best health educational videos on health in the world. In the honor of Cervical Cancer Month, which is January, I have with me a special guest. She's a past student of University of Development Studies, Tamale. During her school time, she had a lot of leadership position. There, she has a lot of clinical experience in her field of expertise. So after her clinical experience at TTH, which is Tamale Teaching Hospital, she proceeded to Tafuji. Over there, she had a 1-year clinical experience, that is her rotations there. There, she was also the secretary to nurses and midwifery in Asante region. Now, she's currently working in one of the specialist hospital in Kumasi, that is St. FF Specialist Hospital, which is located at Denase off Offense Road. So please viewers, help me welcome Beatrice Ajekuma. I call her BB, simple because she's Beatrice and she's beautiful. So I call her Beatrice. Hello, BB.
Hello, Charity.
Good evening.
Good evening.
BB. I must admit that you look fantastic.
You also look good.
Fabulous.
It's been a while. You look
In your
good. You
dress.
look good.
Oh, BB. You're sparkling.
Thank you.
With all your smiles.
Thank you.
BB. Please, with all these looks and who is on the line, you know, your voice
You see me in chambers.
Alright, don't worry anyway. I'm just trying to keep it real.
Sure.
Baby, if you look at global statistic, cervical cancer starting from 2020 to 2025, we realize that the statistics are very increasing in their numbers. So, and then according to WHO, we realize that cervical cancer is the 4th most common cancer in women. That shows that it is very alarming. So first of all, I think that's why we are here today, so that we can lighten ourselves and to help ourselves live healthy. Once again, you're welcome to Charity's Vitality vlog. Baby, your first question, what is cervical cancer, please?
Okay, thank you for the question. First of all, I'd like to greet all your viewers and then let them know that whatever we are going to discuss here, they should take it seriously. And then as a woman, in a while, you need to listen to education on cancer, cervical cancers pertaining to women only, and have ideas on how you care for yourself and all that. So, first of all, when we say cervical cancer, it is the growth of cells in the cervix. And then we all know that the cervix is located at the lower part of the uterus, which protrudes where to the vagina. So whenever you are being exposed to a certain virus, which is called the HPV, the human papilloma virus, it exposes you to the risk of getting cervical cancer. And then when you are being exposed to that, the body itself initially will fight against it. The immune system will try fighting against it. But then when you don't seek for medical attention, and then it escalates, that is where it leads to the growth of the cancer cells in the cervix. And then you term it as cervical cancer.
Wow. Thank you so much. Maybe I want to know what at all causes cervical cancer.
So mainly, I would say that it is the human papilloma virus that causes the cervical cancer. When you are being exposed to it and you get infected, you don't vaccinate and then you don't treat it. Mainly, that is the cause of it. But then we should also know that we have risk factors, other risk factors that contribute to getting the cervical cancer.
Okay. Thank you, Bibi. My third question is that, so what are some of the signs? What are some of the warning signs that, as a lady, I should know that I am getting cervical cancer, or maybe this is a problem that I'm experiencing some?
Okay, so thank you for the question. Now, as a lady, we should know that the body or the vagina itself, we have discharge over there, but then we have normal discharge. So whenever you see changes in this discharge, you should seek medical attention. Now, the first warning sign that you see on yourself as a lady, that you are maybe seeing it, and then you should know that it's sign or symptom of cervical cancer. The first one is painful urination or bloody urination, or maybe, yes, let me say that one, painful urination. Now sometimes you are there, you don't see any discharge, normal one, but then you start that when you urinate, you feel this painful sensation over there. That one too can be let me say sign of cervical cancer. And also, let me say painful sexual intercourse. Maybe after having the sex you feel pains, and then that one too is part of that.
Wow, so Bibi, are you saying that if you have pain during sex, it might be a sign of cervical cancer? Hello viewers, oh my dear. So if you're watching us and then you experience some, please don't hesitate.
Of course, you shouldn't sit at home. You need to seek medical attention. And also we have this heavy bleeding, painful menstrual bleeding, maybe during, after sexual intercourse. After sexual intercourse, some people actually will bleed.
Oh, they'll bleed. Is it,
yes,
is it spotting or
not spotting? Okay. Sometimes it's not time for you to menstruate. It's not time for the month, but then you still let me say see some bloody discharges or bloody distance for, let me say, about 1 or 2, 3 days, and then you need to seek attention because it's just after the sexual intercourse. And during too you can see, and then maybe after menopause. You see, after menopause you're not supposed to see, because the body itself, the hormones, everything knows that you are done with menstruation. So if after menopause you keep seeing spotting, you see discharges, bloody or something, you need to seek medical attention. It's signs and symptoms of
if Bibi, if I would get you right, after menopause, are you still prone to cervical cancer?
Yes, of course, you are prone. If only you didn't get the pap let me say, I'll get there. If you don't get the pap test, pap smear test, you are at risk of getting, or you don't vaccinate, you didn't vaccinate during your early stage, you are at risk of getting it.
Okay, so what is the age recommendable for this pap smear or the HPV test? Am I right?
Well, every book has its own definition of that, but then I would say that with the vaccination, you should start from 9 years to, let's say, 15 years. Basically, some books will also tell you 9 to 12 years. You should vaccinate, so that at least with the vaccination, it protects you from you being exposed to the human papilloma virus at your sexually.
So this human papilloma virus, the HPV, did you say that you can only get that through sex? So that means that every woman that is sexually active is prone. So that's why it's very vital for them to do the screening, right? Okay, then that's fine. So Bibi, can cervical cancer lead to infertility? The fact you're not able to give birth or something?
Of course. Cervical cancer can lead to infertility because we have some of the treatment for cervical cancer whereby conization. When it gets to that, it affects the fertility. Okay. So you won't be able to get pregnant. And then also we have this, if your parents at the 1950s, there was this medication, I don't know the full name, DES.
Okay.
If you are being given, let me say, for miscarriages and that to prevent it, you are at risk of getting it. You won't be able to get it. It affects the fertility of the woman.
Okay.
It will affect it. So most of the procedures for the treatment affect it.
Okay. So if cervical cancer can be sexual transmitted, so then that means that men are at risk of getting
not per se. Not cervical cancer is let me say transmitted. It's the virus, rather, the HPV virus, the human papilloma virus. It's not only the women that have it, but then you being there, the men have that, like, let me say, the virus, the HPV virus. So you as the woman, at your sexually active age, if you don't vaccinate, if you don't get yourself vaccinated, and you are being exposed to, maybe you have sex, you don't protect yourself, unprotected sex at that stage, and then you get the virus. Once you have the virus, you are at risk of getting it. Yes.
That means, if I would get you right, that means that men who are at risk of getting penile cancer.
Of course, let me say we have cancers that are there. But then with the cervical, because it's the woman that have the cervix.
Oh,
When we look at the reproductive system, so the men actually don't are not prone to the cervix is only pertaining to the
So it's
liver.
a female reproductive organ.
Of course.
Okay. Thank you so much. So my next question is so is there any treatment options for this?
Of course, we have so many treatment options that when you are being diagnosed with it, you need to get to see a medical attention, and then we have so many medical treatments. We have the immunotherapy, whereby the immune system will start to, let me say, do its work, and then we also have the radiation therapy, whereby we uses high energy to do that, and then maybe the cancer cells will stop, the growth of the cancer cells will stop. Yeah, we also have this device called, is it colposcope? So you have colposcopy, whereby I think parts of the
what? Can I?
Is it colposcopy?
Oh wow!
Yes,
I don't want
course.
to try.
We have that one. So that one too is there. It's a procedure on its own, and then we have, is it biopsy. We all know that biopsy is we're taking parts of the tissue. So we have so many types. It's a bunch biopsy also. So it is whereby I think they will use some needle to scrape parts of the tissue over there, and then they will go and do analysis about it. We also have, I think there is another one I've forgotten, whereby it's like, is it needle like something also? They will use it and then take parts of the tissue too, and then go and do examination on it, and then find out where the growth has gotten to, where the we know we have types of the cervical cancer.
Stages.
We have the stages as well.
But just like breast cancer, we have stages.
We have stages. We have stages. So they have to know where the stages, and then the kind of treatments that they will give to you.
Okay, all right. So, Vivi, is there any lifestyle changes or dietary adjustment that says someone can do to reduce the risk of getting cervical cancer?
Well, I would say, of course, we have so many lifestyle modifications that when we adjust ourselves into, we will not be at risk of getting the cervical cancer. The first one I will talk about is the smoking, tobacco smoking. Tobacco smoking. You see, sometimes you put yourself at risk too much of this smoking. Smoking exposes us to a lot of cancers, especially with lung cancer. So automatically, the more you are smoking, the more you are predisposing yourself to getting the cervical cancer, because your immune system will even go down. It wouldn't be able to fight against infections when they come into the body. And then secondly, having so many sexual partners. You see, young ladies of today, we think that we want to have so many boyfriends or partners around, and then we would think that we are the bosses, we are the others. No, it's not like that. The greater you are having those number of partners, the higher you are at risk of getting, because you might visit Kweku today, the next person you are visiting Kweku, the next person you are visiting Kwabena. And then you could go to them, and then they won't even put on condom. You won't even protect yourself because they want to feel you. They want So you also
remember in Ghana there's no free lunch.
Of course. So definitely, as you are going to this person, the next you wouldn't know the one having the HPV variant, then they will give it to you. You see, so the greater number of partners you are having, the higher you are at risk of getting cervical. And also sexual activities at an earlier stage. And so we have class 6 students nowadays at the age of, let me say, 12. 12 is even far, 10 years. We even hear in the news that 10 years old is pregnant. That earlier stage that you're having this, maybe you've not vaccinated against the HPV virus. So definitely you are at risk of getting. So when we avoid all this sexual activities at the earlier stage, and then having at least one partner that you stay faithful to, we stop this tobacco smoking, and then also practicing this personal hygiene for we the ladies. You change your let me say sanitary pads within 4 hours, and then in the day you try and then bath twice a day. Then you stop this douching bath, this harsh soaps that we put over the douching bath, buying this feminine washes. putting them here, putting them there. It wouldn't help us. It's not helping us at all. So we should all stop. We have to put an end to that. We have to put an end to that and then try and then adjust. At least when you adjust to that, you now that you feel that I'm proud of myself. And then we should practice safe sex. Okay? We should, even if you are married, practice safe sex at times. You are not supposed, not that you are supposed to, let me say, always use your body to not your husband to come closer to you, but that is not it. At least sometimes we know we the men, we are in the Ghanaian society.
I don't get that. How do I practice safe sex when I with my husband?
Of course you are,
Do I need to use condoms?
not sometimes you need to protect yourself.
Oh, it's
At
my
least,
husband.
of course he's your husband, but at least you know that, you know, we the Ghanaian men, they have this perception that as a man, you are a man, so you can.
So now the side chicks are more,
you wouldn't know maybe the person has been exposed to the virus. You see, not that you are protecting, but at least, or even if you are not protecting yourself, sorry for my words, you the woman, at least get yourself vaccinated, or even within the year, not even within the year. Let's say women or ladies at the age of 21 to 29 years.
Okay.
If you are not vaccinated, every 3 years, get the pap smear test.
That means there should be,
of course, every 3 years, every day, and they're at the age of 30 to, let's say, 40 something or 50 something. If you are not, if you've not gotten yourself vaccinated, you need to get it every 5 years.
Okay.
No, you will get the pap smear test every 3 years, but then if you want to get the HPV test plus the pap smear test, it should be every 5 years. And then when you've passed menopause, let me say 50 and above or 65 going, that one, if you didn't get the let me say the test or the vaccination at the earliest age, you can test for it, or maybe also you can vaccinate for pandemic.
Okay, so Bibi, my last question is that is it possible that somebody who's a virgin has not tasted that rice is prone to cervical cancer?
Well, I would say no, because once
is it genetic too? Maybe from your mother or something.
Cervical cancer is not genetic, but then once let me say we have cancer in your family, you are at risk.
Okay.
You are at risk. I don't know. I think maybe I'll read more. It could be that genetically, but then once you get it when you are exposed to that, and you are not sexually active with that one. But then we should know that at the age of 9 to 15 or 9 to 12, we should let the ladies and the kids come in vaccinate against that. Because nowadays cervical cancer globally is the leading cause of death.
Okay. So if it is recommendable for us to vaccinate even our young kids, like at the age of 9, that is ladies. So I think it's possible for us to do the men too. Because it's possible that there are carriers to the virus, right?
Of course, once you are sexually active and then you go closer to having multiple partners and all that, you see, normally these are partners, they bring the infection. You see, this one will go to this. You wouldn't know that me having sex with Abner, or me having sex with Ekia, me having sex with Kwejo, me having sex with this person. I'm picking infections from this one to the other one without protecting myself, without practicing safe sex, of course. But then if you vaccinated, it will prevent you from all that cervical cancer predisposing infections.
Bibi, thank you so much for giving us all this education. Thank you for enlightening us. Viewers, are just here tonight has just done justice to the topic, and my advice is that if you're a lady and you're watching me, please take good care of yourself. You have only one life to live.
Of course.
And then after that, I believe in the Bible, after that there's judgment. So where do you go after this? So please take good care of yourself. So thank you so much, viewers. Thank you so much, Beatrice. Thank you so much. If you're new to this channel, please don't forget to subscribe, like, because with this channel, it is the only channel in West Africa and in the world that seeks to give you all the health educational videos on health free of charge.
No. Just go there, learn from it, and then modify your lifestyle learn so many things, and then also seek medical treatment for all your conditions.
Wow. Don't pay me open it.
Wow.
Thank you so much, viewers. I love you so much. You know that, right?